Inflammation of the gallbladder and gallstones. Let's start with the fact that the gallbladder is a container made of flat epithelial tissue whose biological function. There is temporary storage of bile that is produced by the liver and used during digestion of fluid. The liver slowly but continuously produces this liquid so that after the meal is completed it is separated into the duodenum where a person digests food with bile and other digestive enzymes. The bile helps and actually helps digestion. It facilitates the absorption of fats. The conflict that triggers a change in the discussed epithelial tissue is the so-called conflict of anger related to possession. Quarrels and disputes with the owner of something, dislikes connected with possession of things or any object belonging to us. The change of the gallbladder in the right-hand man causes a property conflict, while in the left-handed woman the identity conflict. So far so much. In left-handed men or right-handed women, changes of this type do not occur directly unless the conditions change. I will not go into it now. It is important that the gallbladder responds to the period of conflict when the right-hand man, for example, gets angry. And in the expression, in this expression is not without the word "call" is the word poison, because the liver is just filtering and processing all the poison that hits the body. So as a result of the anger and wiring, the walls of the gallbladder and liver ducts become thinner. The biological meaning of this change is that it widens the diameter of the hepatic ducts and thus the path that bile flows. The gallbladder is enlarged so that it can store more bile. The overall flow of bile is improved. Assimilation is the goal of the change. To make it easier for us to digest what is poisoning us or anger. So in the active period of conflict there is ulceration. Epithelial tissue becomes thin. And then hypersensitive. This means that when the ulcer is built from the epithelial wall of the gallbladder or bile ducts, then it involves pain. Man feels stabbing and searing pain in the lower abdomen and the ribs, feeling abdominal tension. This is primarily a warning sign it is high time to stop getting mad. When a man gets rid of the conflict, he calms down, he can laugh again. And at least for a while to look at their side problems. 30. Stop blushing, stress them. Then the pain will disappear like a hand took. Symptoms after the conflict are easy to bear. I mean periods A and B. Because of the epileptic crisis in the midst of convalescence, hepatitis, jaundice, hepatic colic or liver coma may occur. Hepatic coma is not a coma in the common sense of the word, but longer or shorter loss of consciousness, which occurs as a result of the appearance of a brain tumor of the brain tissue containing the hepatic tissue hepatic control relays. This area swells, oppresses the environment, and the person loses consciousness for a moment. But it's even better because during the crisis there are more severe pains. And thanks to the loss of consciousness, a person seems unconsciously passes through this period. When he regains consciousness, the pain will pass. So in biology everything makes sense, even if it initially seems strange or incomprehensible. In parts A and B of the period after the conflict is resolved, the tissue is completely insensitive. At most we may experience discomfort and pain due to swelling of the bile duct and narrowing of the light, which stops the gallbladder from reversing. Also occurring during the epileptic crisis of the hepatic coma is unpleasant. Hepatic coma can also cause this to be called the thrill of emotion, because if I say that it poses an immediate threat to life, it would be exaggerated. When GGT, gamma, rates fall, then the person loses consciousness instantly. This can happen, for example, when driving a car as a result of a violent, sudden and intense conflict. After such an experience, the crisis is as sudden and intense. Within a few seconds the man gets stark in front of his eyes and loses consciousness, but returns to himself as quickly as possible. This is the so-called fast course of the crisis. In summary, changes in the gallbladder in the right-hand man signify the conflict of anger and strife, property, rage. But left-handed women are the result of identity conflict. Interestingly, the conflict of affiliation, decision-making and personality left-handed woman attacks exactly the same area of the brain as the ownership conflict in a right-handed man. But let no one raise any doubts, because in biology, in new medicine, in the science of change, very precisely described laws governing these processes. It is important to pay attention to nutrition when biliary bile inflammation. This is because the less we burden our body, the less bile it must produce. You should therefore eat foods that somehow relieve the liver. You should eat as easily as possible easily digestible vegetables. Boiled products minimize fat intake. After all, the main function of the liver is digestion of fats. If we do not eat them, then the liver will not work intensively. And even if someone suffers from total biliary obstruction, it will not cause such pain as the person who will allow the stew. Because in such a case man unnecessarily tightens and produces a large amount of discharge which is uncomfortable. This can be prevented by taking care of easy-to-eat liver-fasting meals. Then even if we suffered from a property conflict, we can at least be able to live the symptoms of convalescence more easily. It would be relatively easier, or much easier to say, than if we did not pay attention to nutrition. There is no such polyp gallbladder. What you diagnose as a gallbladder polyp is actually a swelling of its wall. So in this case the term polyp is gently exaggerated, because it is not a dangling creature. Only the bulge on the inner wall of the gallbladder. Another thing that in new medicine, we are trying to eliminate this type of generic old-fashioned terms, which among other things is polyp. Of course we know and use them, but only to define endodermal cellular hypertrophy. Because the gallbladder does not contain adenocarcinoma on which a standing or hanging appendix may appear an endodermal change called a polyp. It is physically impossible to define it in relation to the gallbladder. Therefore polyps of adenocarcinoma. It can arise, for example, in the intestine, where is the cylindrical epithelium which actually is able to produce cauliflower tumors called polyps or cancer. In principle the name does not matter here. In the bile sac, however, there is no such tissue. Because of this the polyp of the gallbladder does not exist. If someone hears that he has such a polyp, it means he got angry earlier but he stopped. The inflammatory process of restoring normal gallbladder wall, which is swollen and so much, began. Especially since nothing can be done about these beads. The gallbladder is the best, which does not mean more tragedy. You just have to think about the fact that the existence of a gallbladder makes sense, and Mother Nature does not place it in any of us without a reason. It is so despite the fact that the man withstands his removal is relatively uncomplicated. The consequence of repetitive anger may be the frequent closure of the biliary lumen. This causes extreme bile duct overgrowth. The largest human gallbladder I've ever seen had a diameter of 7 centimeters. It was about 5 times bigger than the standard, healthy, gallbladder. The person concerned was furious and stressed every day. This resulted in chronic gallitis, The bile could not flow freely from the bag, and because this condition lasted long, and for a long time in the gallbladder was too much fluid, this led to its extreme overgrowth. However, you should not get into a similar situation knowing that it is caused by a conflict of ownership, identity, or determination of your opinion. If a person is paying attention to this, do not get angry, or if you've already managed to get upset, quickly calms down. This will eliminate the development of dangerous changes. Bile stones also develop under the influence of recurring conflicts. The chemical and mechanical background of the formation of stones is formed in the active period of the conflict ulceration of the walls of the gallbladder. As a result, they became thin, which then during convalescence with cell multiplication leads to the formation of polyps, swelling on the wall of the pouch. The swollen area, as it was caused by inflammation intended to regenerate the depleted tissue, produces a specific secretion. The sick again falls into a conflict that causes ulceration again. Then the conflict passes and the regeneration process begins again. This continuous switch between anger and silence leads to the secretion of the previously discussed secretion resulting from the regeneration process into the gallbladder, where it is crystallized. Calcite is precipitated. Calcite crystals which form gallstones can be produced. The point is that because of the cyclical activation of the conflict, as a result of continuous switching, the inflammation that comes from the inflammation that I indicate is needed to regenerate, however uninterrupted. Therefore gallstones are taken. The good news is that as long as the diameter of the stones does not exceed centimeters, it is not necessary to remove them. A 2 mm stone in 1 or 2 years may disappear by itself, literally dissolve in the contents of the gallbladder. On the other hand, if there is a recurrence of conflict, let's say someone has a stressful life that is constantly getting angry, it will be better to remove even a 1 mm stone, because it will not be decayed anyway. And if this tiny pebble gets into the bile duct, this will cause a blockage in the flow of bile, and that in turn can cause monstrous pains. Therefore, if there are stones, should try to stop angry. And if the stone is larger, you should definitely think about removing it, because it is an uncomplicated, enduring treatment, needed if you cannot afford a quiet lifestyle. In cases where liver pain occurs after eating, this means that the person is going through a conflict. That is why the pain occurs after eating. Because if you do not eat it, it does not emit a lot of digestive juices needed for digestion and absorption. When a person gets well, the digestive system starts. When bile production begins, we begin to feel burning in the bile ducts, or even in the pancreas if we are dealing with its changes. Pancreatic pain occurring after eating has the same as the pouch pain of the formation mechanism. So the pain after eating means that a person, even if gently, however, there is a conflict of irritation. It often happens that a patient cannot calm down for a week because of anger. Whenever you wake up in the morning, you still have no problem at the back of your head.